How does the UHC Act's goal of an integrated and comprehensive approach necessitate the adoption of a unified health information system? The Universal Health Care, or UHC, Act of the Philippines emphasizes an integrated and comprehensive approach to health service delivery. This means that health services should not be fragmented or isolated, but instead interconnected across different levels of care, from barangay health stations to provincial hospitals, and coordinated among public and private providers. The aim is to ensure that every Filipino, regardless of location or socioeconomic status, can seamlessly access preventive, promotive, curative, and rehabilitative and palliative care. But for this to happen, there must be a unified health information system. Why? Because information is the backbone of integration. Without shared data, health facilities would act in isolation and patients would suffer from repeated procedures, lost records, and poor continuity of care. With a unified system, however, patient information can flow seamlessly, from the barangay health station to the rural health unit and up to the provincial or tertiary hospital. This supports continuity of care and avoids duplication of services. It also allows the government to monitor health outcomes more comprehensively, not just curative services, but also health promotion, disease prevention, and rehabilitation. In addition, policymakers can make fairer and more strategic decisions when allocating resources because they have access to standardized, reliable data across all regions. And lastly, a unified health information system ensures accountability and efficiency. It reduces gaps and overlaps, allows real time monitoring of health programs, and provides strong evidence for future policy development. So, to sum up, the UHC Act's vision of an integrated and comprehensive approach is only possible if we integrate information as well. In other words, you cannot integrate healthcare system delivery without first integrated health information.
So now I'll be reporting the specific applications of Republic Act 11223 or the Universal Healthcare Act, particularly its provision on health information systems, and what this means for us nurses. Under Republic Act 11223, all government and private health facilities are mandated to maintain an electronic health information system and contribute to the National Health Data Repository or NHDR. This ensures that patient records are digitized, standardized, and integrated across the country. The goal is to promote continuity of care, minimize fragmented records, and support better health system planning. Now, what does this mean for nurses? First, it affects our documentation and record keeping. Instead of traditional paper charts, we are now required to use electronic health records. This demands accuracy, timeliness, and completeness in our documentation. Second, it enhances clinical decision making. By having access to the NHDR, nurses can view comprehensive patient histories, which allows us to perform better assessments and provide evidence based interventions. Third, it improves care coordination. Since the systems are interoperable, nurses can coordinate easily with other health professionals, making referrals, follow-ups, and continuity of care more seamless. Fourth, it strengthens patient safety. Digital systems have built-in features such as alerts for drug interactions and standardized documentation, which help prevent medical errors. Fifth, it supports health promotion and surveillance. The NHDR provides population-level data that nurses can use to identify health trends, plan community health programs, and deliver preventive services under the Consulta package. Sixth, it emphasizes accountability and data privacy. Nurses must ensure compliance with the Data Privacy Act to protect patient information while using digital systems. Lastly, it impacts our professional development. This mandate highlights the importance of digital literacy and informatics competency in modern nursing practice. The creation of the NHDR and the shift to electronic health information systems reshaped the role of nurses. We are no longer just record keepers but also active users of digital health data for decision making, coordination, safety, and community health. This provision under the UHC Act elevates nursing informatics as a vital tool in ensuring accessible, equitable, and high-quality healthcare for all Filipinos. I will now discuss how the UHC Act emphasizes the role of primary care providers as the initial point of contact for patients and how this provision leverages nursing informatics. Under Republic Act 1123, also known as the Universal Healthcare Act, primary care providers are identified as a first point of contact for patients. This ensures that healthcare services are comprehensive, continuous, and well coordinated. To achieve this, the Act mandates the use of digitized and interoperable health information systems, which makes nursing informatics a key tool in delivering patient-centered care. Here are the ways this provision leverages nursing informatics. First, electronic health records or EHRs. Nurses can access and update complete patient histories, preventing duplication of tests and ensuring continuity of care. Second, clinical decision support. Informatics provides digital alerts, protocols, and evidence-based guidelines that improve the accuracy of nurses' first contact decisions. Third, risk assessment and prevention. Informatics tools help primary care nurses identify high-risk patients early, aligning with the UHC's Consulta package for preventive care. Fourth, referral and coordination. Digital referral systems allow tracking of patients across different facilities, ensuring smooth transitions and follow-ups. Fifth, telehealth and e-health. Informatics expands the reach of primary care to underserved and rural populations, promoting equity in healthcare. Sixth, workflow support. Automating documentation and reporting reduces administrative burden, giving nurses more time for direct patient interaction. This provision integrates technology into frontline healthcare, empowering nurses in their role as first contact providers. Through nursing informatics, primary care services become more accurate, efficient, and patient-centered, directly supporting the UHC goal of accessible and equitable healthcare for all Filipinos.
And now we're going to talk how does the Universal Healthcare Act in conjunction with other laws like Data Privacy Act or RA 10173 regulate the security and privacy of patient information within the new health information system. This is how they regulate the security and privacy of patient information within the new health information system. First is digitization of records. Both government and private health facilities must digitize patient health records. Number 2 is integration of records. Patient health records must be connected across facilities for continuity of care. Number 3, accessible information. Doctors and health professionals should be able to access records quickly to avoid repeating unnecessary tests or procedures. Number 4 is protection of patient information. The law emphasizes preventing unauthorized access, data leaks, or misuse of records. And number 5, DOH and health responsibilities. They are tasked to ensure that only authorized personnel can access the health records. Number 6 is the confidentiality safeguards. Strict rules and system must be in place to protect patient privacy in health information system. And this is the rule of Data Privacy Act or RA 10173. The Data Privacy Act of 2012 complements the Universal Healthcare Act by providing clear rules on how patient data should be handled. It classifies health data as sensitive personal information, which requires a higher level of protection. And under this law, health institutions must obtain information consent before collecting or sharing patient information. Number 2 is use patient data only for legitimate medical purposes. Number 3, implement security measures such as password protection, encrypted storage, and secure systems. Lastly, limited access to patient records only to those directly involved in the patient's care or those legally authorized.
How has UHC Act spurred a need for changes in nursing education and training in the Philippines? The digital and primary care demands in RA 11223 have expedited the necessity to revise nursing curriculums and continuing education. So these are the major changes and recommendations. So the first one is the inclusion of nursing informatics as core competency. So nursing programs should take EHR documentation standards, clinical data terminology, and basic health data analytics and clinical decisions support use. So, various Philippine research studies and curriculum reviews suggest that informatics content should be enhanced to equip nurses with digital record system and telehealth. The second one is the practical EHR training and simulation. So students are expected to work on real or simulated EHR and encounter medical situations with digital tools such as that they are able to act as bedside data stewards on higher date. Available evidence of EHR implementation studies demonstrates that training mitigates the number of errors and facilitates adaptation of the flow work. The third is the education in data privacy and professional ethics. So teach RA 10173 basics, consent practices, breaching reports, and professional obligation regarding to digital data. Legal obligations are best learned with the help of case studies, and the fourth one is the interprofessional and primary care training. So focus on team-based care with simulated referral with coordination exercises like nurse to physician to fill health claims or administration, as well as training on community health informatics to allow nurses to deal with registries and with population health work. The last is the career pathways in informatics and quality. So nursing schools and CHED accredited programs are encouraged to provide course options or graduate certificates in nursing informatics, clinical informatics, and health systems management to address the need of EHR user, data quality officer, and NHDR reporting implementer. This serves to fill the gaps in national manpower and the requirement of unified nursing database.